Hello, my name is Jay Vanston, and tonight's presentation is entitled Adult Education and the American Academy of Hospice and Palliative Medicine 2016 Board Review Course. My name is Jay Vanston, and I am a physician at Cooper University Hospital. This presentation is part of the requirement for the Applied Instructional Techniques and Practices, the fourth course for the Certificate of Graduate Studies at Rowan University. The objectives of this presentation are threefold. The first is to describe the American Academy of Hospice and Palliative Medicine's need to update the 2016 Board Review course. The second is to review the process by which adult education principles were applied to this task. And the third was to discuss the practical challenges we faced in the implementation of these principles. The American Academy of Hospice and Palliative Medicine is a professional organization for physicians specializing in hospice and palliative medicine. It's headquartered in Chicago, Illinois. Membership is open to all healthcare providers committed to improving the care of patients with serious or life-threatening illness. And in this mission statement, it kind of captures what the organization is all about. The American Academy of Hospice and Palliative Medicine aims to optimize the care of all people and families living with serious or life-threatening illness through the advancement of hospice and palliative medicine. It is a large organization. It represents nearly 5,000 physicians, nurses, and other healthcare professionals interested in the specialty of hospice and palliative medicine. Members work in a variety of urban, rural, and suburban healthcare settings, including hospitals, hospices, academic medical centers, government facilities, and clinical private practice with varied patient populations, from pediatrics to geriatrics. There are a number of primary practice settings for hospice and palliative medicine physicians. Almost 30% of physicians work in the hospice setting. Another 30% work in academic medical centers. About half of the number of those in the academic setting work in the community hospital settings. And then the rest are broken up between clinical private practices, home healthcare agencies, other organizations, as well as nursing home facilities. Myself, I work at Cooper University Hospital, which would be considered an academic medical center. Prior to coming to New Jersey, I was actually in a community hospital setting and a private practice. The American Academy of Hospice and Palliative Medicine, as you can see, is a rather well-organized and structured organization. It's governed by a 17-member board of directors, 5 strategic coordinating committees, and 29 subordinate committees, advisory groups, and work groups. More than 200 of the members are engaged in the work of committees, task force, and work groups. Our particular task, this particular task was under the Education and Training subcommittee, and you can see that we were kind of worked with all of the groups under that committee in order to pull this project together. The American Academy of Hospice and Palliative Medicine Strategic Plan I thought was important to discuss here just because it gives a sense of what we're trying to do on this project. The first is to strengthen member engagement. The second is to build workforce and leadership from the Academy members. The third is promote quality of care and evidence-based care of palliative medicine, which is critical for the growth of the field. The fourth is to increase advocacy and awareness, including interaction and advocacy at the government level. And finally is to advance knowledge and competency. And this is really where much of my commitment to the Academy has been involved in, and developing the knowledge and competency of the practitioners. In regard to the advancing knowledge and competency, as you can see, there was a number of committees that are involved in this, but some of the educational activities that are provided by the Academy include an annual assembly, which thousands of individuals attend each year. The other are self-study materials, for example, HPM Pass, which I will discuss later on, but is almost 100 questions that are board review type material where people can self-study and determine whether or not they're getting the correct answer and why they may have made a particular error on a questionnaire. The Unipack series, which is a broad review of many of the large topics areas of hospice and palliative medicine. There are a number of webinars that are developed each year which may look into specific topics that members are interested in learning more about. And remember that the American Academy of Hospice and Palliative Medicine is also involved with hospice care, and so there's a Hospice Medical Directors Conference and other publications. The focus of this presentation is on the board review course, which is provided by the American Academy of Hospice and Palliative Medicine for those individuals who want to become certified in palliative medicine. Palliative medicine itself was designated as a subspecialty in 2006, a very young subspecialty in terms of medicine today. The first hospice and palliative medicine board exam was in 2008, and the last board exam without fellowship training being required was in 2012. The board exam itself is provided every 2 years, and the next test will be in 2016. Current requirements to become board certified in palliative medicine is that one must complete a 1-year fellowship training after becoming certified in a primary specialty. That primary specialty can be internal medicine, family medicine, PM&R, anesthesiology, psychiatry, neurology, surgery, or pediatrics. The reality is that most hospice and palliative medicine physicians will come from the internal medicine and family medicine arena. In the pediatric area, obviously they come from pediatrics. In regard to the AAHPM board review course, the 2012 board review course, which I had the pleasure of taking part in, was actually quite a large operation. There are almost 1,200 students involved in that, and it involved board review preparation and a broad interest in clinical management. The reason why there were 1,200 participants at the time is that was the last opportunity for individuals to take the board exam without having to do a fellowship exam. In 2014, the I guess demographics would be the best word, changed significantly. There were almost 300 participants. The majority of the individuals who participated in the board review course were fellowship trained, and they had a focused interest in test preparation. The structure of the 2014 board review was as follows, and Michelle Weckman, who's a physician from Illinois, and myself were the co-chairs of that. It involved a large number of topics, probably somewhere around 30 lectures, and they were focused on pain and symptom management, psychological and spiritual considerations, as well as ethical considerations in hospice and palliative medicine, and also discussions of hospice management and regulatory topics. Each presentation was a half-an-hour PowerPoint presentation. It was simply a lecture-based format and a review of clinical management and knowledge. And every third or fourth presentation there would be panel question and answer sessions. The individuals who gave the previous 3 or 4 presentations would sit at a panel, and while they had been giving their presentations, individuals would ask questions on index cards, and so the people on the panel would announce or review the questions and discuss their answers to it. Unfortunately, and it was a little bit humbling for me, is that although overall the board review course got good reviews, it was clear that there was valid criticism of the structure and the design. Many of the participants who took part in the course felt that there was a lack of focus on board review questions. There was too much discussion of clinical management. Many of the individuals who spoke talked about how to manage particular medical problems rather than specific board questions or knowledge that was necessary to pass the boards. There was limited opportunity for audience participation, and that included things like audience response systems and the like. And there was limited time allotment for particular topic areas that they felt were more important to learn on the boards. For example, hospice rules and regulations, or ethics, or issues of psychosocial depression and those type of topics. And they also felt that there was a lack of additional resource materials for board preparation, that most of the material was just from the lectures, and there was not enough material for them to feel confident that they could pass the boards. So, after receiving that feedback, myself and a number of of individuals from the Academy felt that we really needed to restructure the course to meet the needs of kind of a changing demographics and changing needs of our students. This is the board review task force that was formed, and they began in May of 2015. As you can see, there are a number of physicians, and the nice thing about this group is that they were from a number of different settings, and they spread out across the country. In addition, there was a strong support from the American Academy, and you'll notice Kemiani was the staff liaison who would help coordinate and arrange meetings and provide whatever material the group needed. The objectives of the task force were threefold. One was to discuss and assess the quality and effectiveness of past American Academy of Hospice and Palliative Medicine board review courses. I did not mention it earlier, but the board review courses had been going on since roughly about 2008 and had been happening on every 2 years. The second was to identify the target audience and their needs for the 2016 board review course. And finally, it was to develop recommendations for course improvements by November of 2016. In regard to the task force, our initial meeting was in May of this year, and we came up with 3 areas that we thought were critical. One, in regard to the target audience and their needs, we wanted to know what the size and what the kind of characteristics of the audience would be in 2016. In addition, we thought it would be good to make sure we just take the time to look at the blueprint of test topics that were going to be part of the 2016 board exam, and also to take an opportunity to survey fellowship directors and current fellows to determine what they felt their needs were. The second task, which another kind of subgroup of the committee looked into, was current practices, and that was an opportunity to just look at other board review courses, see what was being done, to be honest, steal what we thought was helpful, and not make some of the mistakes that other organizations were also making. And finally, the third area was to really look at the adult education principles and their application to the American Academy of Hospice and Palliative Medicine board review course. And part of that was that idea was stimulated by participation in the Certificate of Graduate Studies at Rowan University. In regard to the target audience, the members of the Academy were able to kind of do this statistical analysis, and they came up with the thought that 30% of the current, in the last 2 years, 500 physicians will have completed their fellowship, and we estimated that 30% of those individuals would take part in the board exam. A small number, 5% of the 2008 diplomats, would be eligible to take the boards in 2016. It was not felt that many people would take this board exam early because it did not bring any particular advantage to it. However, we did think there might be some individuals who would do that. And finally, there would be a very small number, probably 20 to 30 individuals, both physicians and non-physicians, who were seeking clinical review. So the estimated total for 2016 board review course was about 210 participants. Again, in regard to target audience, the second area is to look at the ABIM blueprint, and you can see that there are a wide range of topics. However, medical management was probably close to 50% of it, and that's the medical management of common problems associated with patients with advanced disease or who are in the terminal phase of their disease. Other areas included approach to care, psychosocial and spiritual needs, impending death as well as grief and bereavement, communication, teamwork, ethical and legal decision making, and prognostication. So wide topic areas and with an emphasis on medical management overall. In regard to, the Academy was kind enough to kind of put out a survey, and I'll go through some of the key questions that came out of that. I'm not sure how strong some of the information was statistically, but it did give us a sense of kind of what we thought we would find in terms of those who were interested in taking the board exam. First of all, almost half of those who were surveyed, and unfortunately the number was only 22, almost half said that they would probably take part in a board review course in summer of 2016. We had actually estimated, as you noted, you might recall earlier, that about 30% of people would take part in the boards. In regard to fellowship directors, almost 2/3 of them felt that graduating fellows did need a board review course to prepare for that initial certification exam, and which was also consistent with what we thought they would say. This I thought was interesting, is that what do graduating fellows need in the board review course? And again, it fit in terms of some of the reviews we had gotten of the 2014 course. You'll notice on the right that only about half of the individuals felt they needed to gain knowledge to improve clinical competence. So most individuals feel that they have the clinical skills and don't feel a great need for that relative to other topics. But most were very certain that they needed to review topics on the exam blueprint, practice exam questions, and a focus on gaps in knowledge for the purpose of the test. Interestingly, in keeping with adult education principles, that people wanted a variety of teaching methods that they felt were effective. Some wanted lecture, others wanted small group case studies. There's a number of people who are interested in online learning, as well as self-study materials both before and after the course. So I thought it was interesting that many of the things we've talked about in adult education were coming out in terms of what people felt they needed and how they wanted to study, so which wasn't just a one-size-fits-all group. In regard to review material, a number felt that they would kind of which self-study materials would be most helpful. I'll point out that board reviews course handouts were felt to be important. In addition, something called the HPM FAST or HPM PASS, which are actually online test questions on individual topic areas, and I'll get into more detail with that later on. So, the second subcommittee or subgroup looked at current practices of other board review courses. And again, most board review courses, because they have to review a great deal of material in a short period of time, are lecture-based. However, a number of organizations looked at board-like questions with each presentation. Audience response systems were almost universally applied. There were a number of organizations that used small group sessions with a focus on a particular topic area, and sometimes this was well suited to particular areas. For example, the American College of Cardiology would have EKG reading, for example, in a session, or the review of echocardiograms and the like. So small group sessions that allowed people to focus on an area of their interest. Handbooks with copies of all slides and answers to board-like questions. Again, this emphasis on board-like questions. And also people like the opportunity to meet with faculty members and kind of rub shoulders with them and hear how they approach particular problems and ask individual questions. Finally, the third subcommittee looked at adult education principles. And I apologize, Dr. Sisko, but this is the only picture I could find for you on the internet. But it's a nice picture. It looks like it's a little bit outdated, but however, I think it captures the essence. But we had in July, Dr. Sisko was kind enough to kind of meet with a number of the physicians via phone conference, and an opportunity for us to ask questions and think more about what adult education principles would be important. And some of the things that fell out of that discussion included, number one, really taking time to understand the student's needs. And some of the things that were clear through our discussions that we will have fellows who have a wide range of experience. Some people will have come from a program that was oncology based, and others might have come from a program that was more pediatric based or geriatric based, and so we needed to take into account that our fellows, even though they had all completed a one-year fellowship program, that their actual background might be different and they may require emphasis on particular areas for their board exam. The idea of having a pre-conference assessment tool where we could understand what the needs of the individuals were before the conference was an idea that was discussed. It was clear that the opportunities to interact both with faculty and with each other should be something that should be fostered. And some of the ideas around that area included audience response systems, informal meetings with between members of the group or members of the board review course as well as faculty, and also breakout sessions where particular topics could be discussed in a smaller group with skilled faculty members. The other adult education principles discussed was student choice, that individuals could determine, for example, if there was 3 or 4 breakout sessions on particular topics, they could decide which topics would be most helpful for them. And also, again, that opportunity to have informal discussion groups with faculty at their time and choosing. Also, I think it's been clear from our learning that varied methods of teaching are critical in order to kind of meet the needs of a wide range of students. Again, audience response systems are nice because they allow for that individual to know where they stand. But we also talked about a flipped classroom sessions where information would be given ahead of time, and the talk would be more about problem solving and discussion. And again, breakout sessions. And the final area was this idea of a learning community, that somehow we could get these individuals involved in a community that could continue to prepare for the boards and support each other going into the board exam in 2016. So the consensus after a number of kind of discussions and back and forth phone conferences and emails were some of the following kind of broad categories. One was that we did feel that a pre-conference self-assessment would be important for our participants. However, it was very clear that the manpower needed to create a kind of a formal assessment for our students before they came to the board exam simply was not available. Almost all of the individuals who work for the Academy have full-time jobs and are strictly working on a volunteer basis. However, what was interesting for us is that something called the HPM Pass, or Hospice and Palliative Medicine Pass, was a series of questions, almost 100 questions that were board kind of review type questions that were vetted and well designed, were created in the past, and they were used by many people for prior board exams. It actually turns out that HPM Pass is being redeveloped and should be available prior to the 2016 board review course. And so we thought that this could be added to the conference package for individuals who wanted to kind of assess their knowledge and gaps in knowledge before they came to the exam. We wanted to attempt a flip room classroom and lecture. Handouts and other materials obviously are available in advance, and we thought that it would be best suited for common topics. For example, fellows are well versed in pain management, or should be by the time they come to the board review course. Therefore, for us to review the fundamentals of pain management is simply not reasonable. However, there's a great opportunity for them to just review whatever material they thought was necessary and really have the discussion or lecture focused on a problem-based approach that would be helpful for boards. For the other lectures, and to be honest, I think some of these, like flipped classroom, we can probably do for a number of classes, but not for a large number. The other lectures would be use the active use of audience response systems. It should have a test-oriented perspective with questions to anchor the discussions, and a focus simply on 3 to 5 key board important points in a 30-minute lecture. And the other areas, breakout sessions, that are a more focused review of specific areas with an opportunity for more interaction with faculty and back and forth, and an opportunity to discuss specific questions that they had before the test. A learning community was felt to be important. We did not feel at the Academy that we could create that ourselves. However, a number of Academy members are involved with Palamed. It's actually palamed.org. And in 2014, they actually had created a section called Blogs to Boards, where kind of question topics were brought up and questions were developed, and the members of Palamed were actually able to discuss and talk about what they thought were important for the boards and questions they thought would be helpful. And finally, this was my idea, and I've kind of still continued to try to push it through, is that I thought that we should at least, rather than have it strictly focused on boards, that we should have an opportunity for 1 or 2 thought leaders to come and actually talk to the group about palliative medicine as a whole, the history of palliative medicine, how it stands today, and what's available in the future. And I decided that whether they knew it or not, they needed something like that. And so on that particular topic, I don't care what the students want. We're going to try to do that. It's important. So some of the practical challenges we face, though, are real. Some of them are based on finance, some of them are manpower. Audience response systems are good, but we need to make sure that the technology is reliable and works fast. Cost can be excessive, although today with Apple phones and other systems it seems like we can get that down quickly. But we need to be in a facility that has good Wi-Fi, good kind of connection to the internet to allow for that. Flipped classroom is a great idea. We probably will do this with 2 or 3 of the topics. It does require a significant amount of pre-conference material to be put together, and also faculty preparation. Breakout sessions also require an increased faculty number. If we have 200 students and we need to bring them into 3 or 4 breakout sessions, that would be 50 per session. We would clearly need to have more faculty to bring that down to a much more manageable number. And so the logistics of working effectively with a large number of students, even if it's 20 to 25 students in a group, has to be worked out. Again, many of the faculty members are used to kind of giving a lecture and answering particular questions, but not really in that kind of interaction and classroom interaction that we're hoping for. Faculty development, as I mentioned before, is important, both in terms of kind of using flipped classroom, working with breakout sessions, and kind of teaching in a different way. So that will require some faculty development on our part. And the other area that is actually quite difficult is test writing skills. I'm sure, actually I'm speaking to the choir here, but writing good test questions is difficult, and it takes a good amount of time, and it's also something that I learned more about in the courses we've had about how hard it actually is. But I've tried to do it myself, and I can guarantee that it takes time to do it right. The third is kind of challenge, or the other challenge was the learning community. Is that how do we coordinate with other organizations and kind of get an organization like Palamed to work in coordination with our efforts. So the next steps as we move forward is really to figure out how we're going to assess the success or failure of the 2016 board review course. That is next on our agenda, but we don't have the answers yet. Clearly, much of it will depend upon the feedback that we get from the individuals who are in there, but I think we have to get the right kind of questions. We don't have direct access, although we can survey of what people's success was on the board, and we can also survey them after the boards to feel out how they felt that this board exam course prepared them for it. There needs to be identification of co-chairs. I will be one of the co-chairs, but we're looking for someone who has kind of augment or fill in for my gaps in terms of the management and development of this. And I think that all of us would agree that if you get the best teachers around you and the best people, many of our problems will be solved. And finally is develop a detailed schedule, something that actually works and is flexible. And once we've done that, then the real work begins of pulling this all together. In conclusion, I'd like to say that adult education principles can be successfully applied to the development of a board review course. I think we were able to demonstrate that during this process, and I hope that it will be successful in the end. There is a broad interest in this area on the part of faculty and students. I was actually surprised by the number of academy individuals who are very interested in how we can look at adult education and apply it, and students are very interested in and fellows are very interested in kind of how we can better prepare them for the boards. None of this would have been possible, at least the success that we've had so far in pulling this together, without a great deal of teamwork and collaboration. So I think that's critical to the process. So it's been very educational for me. So in conclusion, I'd like to say thank you. I'm going to end the presentation here. I'd also, I use the Buddha because I just like to thank the faculty at Rowan for all of their time and effort in putting together the Certificate of Graduate Studies for us in adult education. They talk about the Buddha being enlightened, and I have to say that I knew very little about adult education, and now that I feel that at least I'm certainly not a Buddha, but I certainly feel much more enlightened and much more awake as to the importance of adult education and really how to teach in the right way. So I'll close the presentation there, and thank you very much.